Thanks, Gary. Look, I just want to indicate that obviously this gentleman now becoming positive is a very clear reminder to the community just how important it is that if you have any symptoms at all, you get tested. Or if you've been to these particular venues of concern, you should be absolutely on high alert to get tested. I want to reiterate the fact that if you've had your first dose, or even if you've had 2 doses of vaccine, and you're in the eastern suburbs or you've been to any of these venues of concern, you're still required to go and get tested. You must be tested, because that's the only way that we can actually manage this 1 in 100 year pandemic. It's worked very well. I am concerned that up to date it's worked very well, but I am concerned that some who have had the vaccine may think that that's the end of it. Well, it's not the end of it. You may still get the virus, as Kerry just said, but you may still transmit it. So please go along and actually be tested. And finally, I just want to say that the main venues that we have in the eastern suburbs area are the St Vincent's Hospital COVID Clinic, the Prince of Wales Hospital Clinic, but there, of course, are also opportunities to be tested. Many people in that area would know Bondi Beach, Bondi and Rose Bay. We'll also be establishing a couple of pop-up venues this afternoon. I'll make some announcement or put out some statements on that later this afternoon once we've managed to establish the location for that. We've said time and time again, the world is a very dangerous place. Well, in this case, the eastern suburbs may or may not be. So people in those eastern suburbs particularly should be listening to the messages and getting tested for them, for their family and for their community.
Yes, he was symptomatic and he undertook testing, and again, thank you very much for taking those actions. It's assisted us in detecting this case.
The infectious period seems to be, from the 30th of April onwards?
So at the moment, he underwent testing on Tuesday, but I've had some advice that he has considered to be infectious since Friday, the 30th of April.
Was he vaccinated, Dr. Chin?
No, he wasn't, but I'll have to confirm that.
Do you have any sense, is there any sort of working hypothesis of how he could have got this in terms of who he's been or where he's...
Unfortunately, not at this stage. Obviously, we've asked him about, he hasn't returned from overseas, he hasn't worked in border or quarantine roles, he has not had any contact with the hospital system. So all of the usual routes where we would expect someone to have acquired the infection are not clear, and that's why this is really requires us to do that genome sequencing to give us that understanding of where that source of infection was, and then we can work back from that. In addition, we will be testing those around him.